our viewers, karibu sana. This is your favorite show, Moms and Babies, where we celebrate life by walking the motherhood journey together. Nakwambia the last like 4 episodes, pale kwa feedback yenu, tumekuwa tukiona tu, family planning. Na kuna wale walikuwa wanasema bana, sisi hatuwezi hizo vitu. It's fine, but we thank God that kwamba majority of us got the information, and kwamba whenever you are taking a decision in terms of family planning, you have the right information for you to make the right decision. Yes, we are here again. How are you?
Fine.
How are you, baby? How are you? My baby's fine. How about yours? Mko sawa? Kabisa. Na wamejaja hapo. Yeah, so today our viewers tuko na our expert, another episode. Karibu sana daktari. Yeah, Dr. Justus Nondi, okay? Again, nakwambia, again wanakongani wa beshte wakina wa ladies, you know. So today we want to focus on fertility and infertility, an issue ambao pia inasumbua watu wengi sana. And sometimes when it comes to that issue, the blame is always thrown back to the women. Lakini as per the expert, najua kwamba atatuelimisha na tujue kwamba this issue, how do you go about it, and at the end of the day, at least upate your information. Karibuni sana.
Thank you.
Welcome, Daktari.
Thank you very much.
So fertility, infertility. Kwanza, hapo sasa inamaanisha nini?
The topic of fertility is a topic that is becoming very, very important as we move with life these days. Fertility is basically ability of a couple to conceive and give birth to a live baby.
Okay.
Basically that. And infertility is now the opposite. Inability of a couple to conceive and give birth to a live baby. But we have a time frame. You can't just say, I'm unable to conceive for 2 months, now I'm infertile. No, you have to have tried for at least 1 year, having stayed with your, together as couples, with your partner, consistently for 1 year.
Yes.
Yeah. So if you fail to, get a pregnancy, and then we say that we have infertility. Yeah.
Okay. So how do I tell? How do I tell? Like, traditionally, ama kilayman, mtu anasema, niko fertile after ameona mtoi, ama ameona mtoto wa familia.
Yeah.
So, like, how can I tell that niko fertile ama infertile? That is even prior to me labda having a child.
Okay.
Yes.
Yeah, so it's not usually very easy to tell, because remember, your fertility does not depend on you alone.
Okay.
Yeah. We have to look at you and your partner, so that we are able to say that you are fertile or not.
Okay.
So as an individual, there are certain basic things that we need to understand. For example, we need to know whether your monthly periods are okay. We need to know whether your tubes are open. We need to know whether your hormonal levels are good. And we need to know whether your uterus, which is what is carrying the baby, is okay. So with that basic understanding that the uterus is okay, the tubes are fine, the ovaries are good, and you are getting your periods regularly, we make an assumption that you are fertile. But that doesn't mean that you will automatically be in a position to conceive. There are other factors that come in.
Oh.
Yeah.
So hizo vitu zenye mention, like, you mean there are tests that maybe, or there are tests that you do at the hospital to...
Yeah, there are various tests. In fact, infertility as a topic or as an issue involves so many tests, but we can never do all of them. We have to look at what we think your problem is before we are able to zero in on which test, because some of these tests are very expensive. But the basic one is something called ultrasound, that looks at the uterus, and uterus is this organ here. We are interested in knowing whether it is able to carry a baby. So we need to know how the inside looks like.
Okay.
Yeah, we can have uteruses that are not patent, that are blocked meaning there's no space. It's just an organ, but hapa ndani hakuna kitu. I mean, kuna imejaa.
Okay.
Pengine imejaa because of fibroids, imejaa because of things tunaita polyps, growths ziko hapo ndani, and so on and so forth. Then the ultrasound will also tell us whether your ovaries are okay. Some people have things called ovarian cysts that are big and are not therefore able to make the ovary function properly, and so on. Then we have another test that then looks at the tubes, whether they are open. The ultrasound may not tell you whether the tubes are open, but there's a special X-ray that we do to check the opening of whether the tubes are open. So those are basic things that we do for any lady who we are evaluating for infertility or fertility.
Okay.
Yes.
All right.
For a man, because it also affects men
that's
almost
what I want
equally.
to ask,
For a man, we basically look at the sperms. Are the sperms fine? We analyze that in the lab.
Okay.
Yeah. So those are basic ones.
All right. Na mtu akiwa like we have maybe let's say a young girl mwenye labda wants to get in marriage, maybe recommend kwamba ni vitu zenye mtu anafaa ku like to check out such kind of things before you get into marriage.
Yes. Actually, we run a program at my center where I see patients called premarital evaluations, medical evaluations, and so on. So what we do, because when people get married and they have the intention to get children, it is important that they know how their reproductive health is. So there are certain basic tests that we do just to make sure that they are not having any issue. Among the tests that we do are ultrasounds, for example. We may not go to the extent of analyzing the sperms and looking at many other factors, but the basic thing that we need to know is, does this lady have her reproductive system intact? By doing just a quick ultrasound examination. We may also examine the man and see whether his reproductive system is also intact, quickly just by examination and not doing any test. So we do those ones unless now the patients or this couple gives you history or gives you some information that I have had this and this, and therefore in the past nimekuwa hivi. So we go ahead and evaluate and see whether this is any problem.
Are there things that maybe watu wanafanya, maybe food, lifestyle, maybe lifestyle, and kuna hizi mambo za kama maybe the family planning? Just recently we've been talking about family planning that would contribute, some of the factors that will contribute to someone's infertility.
So infertility is a broad issue, very broad. And there are many causes, so many causes. Among the common causes that we know are issues to do with the tube. Most of the cases of infertility happen because the tube is somehow blocked. Well, for you to understand what I'm saying, you will need to realize or to know that for someone to get pregnant, I think we need to start from there so that you understand a bit. For someone to get pregnant, the egg comes from the ovary. This gray structure here is the ovary. So the eggs come from the ovary, and these eggs, they come every month. In a process that we call ovulation. When you ovulate, ovulation is like popping out of an egg that is mature. Just imagine like those maize, those corns in the supermarkets, popcorns. When one pops out, that's how, for example, an egg pops out of the ovary. So it starts from a very the eggs are many in ovaries. We have thousands of eggs, hundreds of thousands. But every month you'll find one egg coming out
Okay.
Yeah, so they start at the beginning of a woman's cycle. That is when periods start. Around that time, eggs decide. I usually call them. They call themselves to a meeting. Okay, and then they decide that
Mimi nitatoka wa kwanza.
yeah, I'm the one who is going to shine. So allow me to shine kindly. Okay, so the eggs say they agree, will allow you to shine. So they allow one of those eggs, and this support that is given to that egg through things we call hormones. So the egg grows in size. It grows, gets good nutrition, and grows all the way until around day 14, if you're the person who has 28-day cycle.
Okay.
So around day 12, 13, 14 there, the egg has grown and is now ready to come out. So on the 14th day, it pops out of the ovary and comes out to get into the tube. Okay, so that process is called ovulation.
Okay.
Yeah, there are some people who are not able to do that, so they cannot ovulate, and that's one of the causes of infertility. Their eggs cannot agree enough that I'm the one who will pop out. Yeah, so they don't grow to the right size, and if the egg does not grow to the right size, it cannot pop out. Yeah, it has to reach a certain size. So when it pops out, it comes, they know their way around there. So it comes and gets inside the open end of the tube and starts flowing in, coming in with intention of reaching the inside cavity of the uterus. Yeah, so when it is coming in along the tube, it should meet the sperm. The sperm having traveled from the vaginal canal all the way to the inside of the cavity and into the tube from this end. So they have to meet here at the middle. Yeah, it is the meeting at the middle here that causes fertilization.
Okay.
Yeah, if they don't meet there, they cannot.
So what happens if they meet here? Is it possible they meet here?
They can meet here at any point within this.
Fertilization will take
It
place.
will take place.
Okay.
Yes. So when they meet and fertilization takes place, they have to agree quickly that this is not our home. Okay. So they have to move very fast. Within 5-6 days, they must reach inside here.
Yeah, let's go to our home.
Yeah, but there are others that once they have done that, they say, okay, us tumefika. Yeah, and they stay there and start growing there.
Yes.
And growing and forms ectopic. You've heard of ectopic pregnancy?
Yeah.
Yeah, so that's what happens. So if they decide to grow there, or if there's anything preventing their movement, then they will not move.
Okay.
And the ectopic will happen. Right. So once that is, the fertilization takes place, we end up with the fertilized egg coming and reaching inside here and now implanting. Implanting is sticking on the wall. Yes. So most of the time, causes of infertility involves issues with the tube.
Okay.
Yeah. Either the tube is blocked, the sperm cannot go and meet the egg. And the egg can also not go and meet the sperm. So that can, and in most of the cases we see outside, as patients come, because of that.
Okay.
Now, what causes this tube to be blocked?
Okay.
Most of the time is infections. There are these infections that you may not take seriously, but become serious and come. When infection happens, there are some sort of discharge produced.
Yes.
So this discharge, instead of flowing out, can flow inside. Then come in and come here and stagnate in the tubes and cause blockage. Okay. Sometimes this tube gets twisted. You can imagine when something is twisted like a pipe, it cannot, inside cannot allow anything to pass. So sometimes you have something called ovarian cysts, very big ones, that come and twist the tube.
Okay.
Yes. And so on. You can also have a situation where someone is born with tubes that are not open. So that one is, there's really very little that can be done about it. Okay. Yeah. We also have the infections coming and making the inside of the uterus stick together. So there's no space. so there's no way sperm will pass. So that also causes infertility. And therefore, if we are talking about the causes of infertility, infection is one among them. We have natural causes where someone is born with it, with the tubes that are not open. Yeah, we can also have situations where the hormones are not working. You find the tube is open, you find the uterus is okay, but the hormones are not good. You've had a hormonal imbalance. Yeah, for this egg to grow and mature and come out on day 14 during ovulation, it has to receive support from hormones. So if you have hormones that are not enough in the body, the eggs just don't grow. Yeah, so hormonal imbalance can cause that. There are times when we've had cases where some surgeries were done and there was a problem with an ovary and the ovary was removed. Such a patient cannot conceive because there are no eggs. Yeah, we've had situations where you end up with fibroids. Fibroids are now pressing inside here, causing sperms not to move well, and when the fertilization has happened, implantation cannot take place because there's no space. Yeah, so that's another cause of infertility in women. Yeah. So that is those are the main causes of infertility: the hormonal imbalance, issues to do with the tubes, the blockage of tubes for whichever cause, and issues to do with the uterus, whether there's anything blocking it or anything making the space not open. Yes.
Now blood group.
Yeah, so we have other causes as well. Yeah, some people have issues with blood groups and all that. What happens mostly with issues of blood group is that fertilization may happen, but the pregnancy is not carried to term. Yeah, it is lost. Yeah. Blood miscarriage. So for blood group issues, we mainly find miscarriages. But fertilization, you're fertile, yes, but you cannot carry it.
Is there a situation? Kuna mtu aliniambia juu niko my blood group ni A.
Yeah.
So I just happened to mention to someone, and then akaniambia, you are so fat. If you don't take care, you'll give birth every year.
No. There's that is a myth. It's a myth. Yeah, blood group and fertility does not have a direct relationship. In the sense that ukiwa A si lazima haimanishi you will be. Yeah. Yes. Yeah.
And now what about men?
Yes. Yeah, that's a good question. So for men, the issue is mainly in sperm production and transportation. Yeah. So we have men who cannot produce sperms. Yeah. They're just not able to. Yeah. So that will mean that they are not able to, they're not fertile. Or you have sperm but it's produced in very small amounts. Okay? So that also makes fertility become very difficult. One thing you need to know is that for fertilization to take place, a lot of millions of sperms are released.
Yes.
Yeah, but it's only one sperm that gets to fertilize. Yeah, I usually compare it to marathon. You know, marathon, these ones that the races. Yeah, we start with
and the
yes. You start as a group, but it's only one person who will be number one, isn't it? Yeah, that's how sperms behave. Yeah, they're not as organized as eggs. Eggs agree that it's only one of us who will do this. Yeah, but for sperms, they start many, and one with will be the one to fertilize. Then you ask yourself, if it is only one, then it means even if a man is able to produce just one, that should be enough, isn't it? Yeah, but that does not work that way. For sperms, I like comparing their action to cheering squad. For it to work, they need support. Yes. So they need numbers from their colleagues to cheer them in order to perform. If it's just one, then you'll have a problem. Yes.
Yeah, by the way, moja tu
Yes.
ndio inamaliza job. But now zimekuwa produced 1 million. So why not just one?
Yeah.
Iende na imalize job.
Exactly. Yeah. Exactly.
Okay.
And then there's certain sperms, once they're produced, they die off immediately. Yeah.
Na kuna vitu, there are some things tunasikia labda for men, there are things they do, the kind of jobs I think they do, mali wanaji-expose, can really contribute to their fertility level. Is it true?
It's true. It's true because remember the sperms are produced in the testes. And that production, anything that affects the testes, be it infection, very high temperatures. The normal body temperature is not good for sperm production. That's why the testis is out of the body. Yeah. And therefore, anything that will make the testis not perform or function properly, like infection, those who are like long truck drivers, you know, they are seated on the driver's seat for so long, and the temperatures are high, and therefore production, the sperms become affected. Then we can have a situation where the sperms are getting produced well, but for it to come from that testis to get out through the piping system, it cannot work. Maybe the pipe is blocked. Yeah, so those blockages can also cause infertility. Yes.
Na daktari, hii issue, before I forget, hii issue nimekuwa nikiona online sana debate, and of course many times inaleta hakunaga, people don't agree boys. Boys wakiwa hii age kuwafunga diaper throughout, does it cause infertility later in their lives?
Not really. Not at all. Yeah, not at all. Okay. Yeah, not at all. Provided you're just you're not hurting them. Yes.
So as long as you put on the right size,
The size,
change on time, it is okay.
That's very fine.
Yeah, so that also means hata maboys when they grow, they have to put on the right pants.
Exactly. Right pants.
The right is it texture or what?
Yeah, texture.
Cotton, manylon, kama hizo.
Yeah, so the basic thing is comfort.
Okay.
They should be comfort, so that's comfortable. Yeah, so that you don't have any kind of injury or any strain to the testis.
Stress inaweza changia?
Stress is a very big factor for both male and female. Remember, for sperms to get produced, again, hormones play an important role.
Okay.
There's a hormone called testosterone. So this hormone has to be produced, and the brain coordinates it, production. So if the stress is there, affecting the man, even production of the sperms becomes difficult. If there's stress in the woman, even hormones that will go to the ovary to cause the eggs to mature will also be a problem. Yeah, so stress is an important factor. And that's why sometimes couples who are trying to conceive and are stressed about it rarely conceive. You know, because it is in the mind, the stress is there. So it's affecting even the body processes. So stress is a big factor.
Okay.
Yes, alcohol is another one.
Yes.
Yeah, very, very important. Alcohol, cigarette smoking affect the maturation of sperms and production. So chronic, I mean, those who are taking alcohol in too much, quantities, and who are addicted have got that real chance of having reduced fertility. Yeah.
Okay. Now, anything maybe genetic?
Yes, so there are also those people who are born with the inability to produce sperms.
Okay.
Yeah. Others are born, you've had something called undescended testis, where the testis remain inside the stomach, the abdomen for boys. And if it remains for long without being corrected through surgical means, it means these boys will become unable to be fertile in the future.
Oh.
Yeah.
Okay.
Yeah.
Na so maybe daktari tukimalizia.
Yeah.
Vile umesema, issues that can make someone to be infertile.
Yeah.
So in which case maybe can it be reversible?
Yeah. Yeah, so we have different ways kutibu infertility. So when we're treating infertility, we target the cause. We just don't treat blindly.
Okay.
So we target the cause. Is it the tube that is blocked? Then we see whether we can do something about it. Is it the ovaries that are not producing mature eggs? So we target the ovary. Is it the fibroids that are making the lady not be able to have fertility success?
Okay.
We treat that. So there are different ways. It depends purely on where the problem is, and therefore we don't have standard treatment for everyone. Then we look at everyone's case and we decide what is best for them. There are some cases that are treatable, others are not treatable.
Okay.
Yeah, like there are people who are born without a uterus.
Okay.
Yeah.
So you can't treat that.
Yeah, you can't treat that. You know, for that, those ladies, the option they have is adoption.
Okay.
Yeah. There are those who are born with ovaries that are not able to produce eggs. In those kind of situations, you might want to assist them by borrowing all eggs from someone. We have that technology.
Alafu unaweka wapi?
So we borrow the eggs. See, they have the uterus.
Okay.
Yeah, we borrow the eggs and we ask the partner to bring the sperm and we mix and the fertilization happens. Then when the baby starts forming, we bring the baby inside here.
So where do you borrow the egg, Daktari?
From the lady, we have egg, they call them egg donors.
Oh.
Yeah. Yeah.
One can be an egg donor.
Yes, as long as there are rules guiding that and so on. So you can donate. Yes, you know, you have had such situations, yeah, where people after donating, they want to make a claim to the children. So one of the things that happen in our country, we don't have proper legislation, but one of the things that people try to do is make sure that it is anonymous. You don't know who you are donating to. Yeah, yes. And then we also have those who don't have uterus, or their uteruses are not functional. They borrow the uterus of someone.
Okay.
Yeah.
And now for the case of the man?
For the case of the man,
inakuwa borrowed.
yes, so we borrow, we call sperm donation.
Okay.
Yeah, so we have sperm donors. Yeah.
You can manage someday.
They can't.
They to donate.
They cannot. For the case of a woman, anaweza kubali, you know. But when the other way around,
They do. They accept.
Hey,
Yes, I have come across many.
really?
Yes, yeah. Where the man accepts to have someone else donate sperm for them. Yeah, it's when they have a problem, and then the sperm is then mixed. The technology is called test tube babies. You've heard of test tube babies? Yeah. So the sperm is mixed with the egg outside the body. Once the baby starts growing, it is brought back to the uterus and it grows at last just like a normal baby. Yeah.
So daktari, nataka kuuliza, I think sijui kama itakuwa controversial, but I just want to ask. So kuna watu wamekaa like 20 years and then umesikia after 20 years in marriage, then God boom blesses us with a child.
Yeah.
No, hiyo inakuanga nini imefanyika?
Yeah, it is possible.
So it's
it
miracle,
possible.
right? A
Yeah,
miracle?
yes, it is possible. You know, God is supreme.
Yes.
Yeah, so it is possible to have that kind of weight. Then the body processes, aligns themselves. Then you find this lady conceiving. Yeah, we usually recommend that when, as a couple, you have tried conceiving for more than 1 year without success, then it's important you visit a doctor, a fertility doctor, to see where the issues are, so that some of these problems, once realized early, you know, treatment is very much possible. Yeah, and as opposed to waiting for long. Yeah, you know, as you wait, remember when a lady reaches 35, her quality of eggs starts going down. Yeah, the eggs are very many, but 35 is the age when the quality starts declining, so that you'll be struggling to conceive after 35. And therefore, sometimes, in fact, most of the time, we advocate for people to always visit the hospitals, so that problems can be sorted when your eggs are still of good quality.
Okay.
Yeah.
Yeah, thank you so much, Daktari. I know because of time, you know, I don't know, but any ningeomba tu producers watupatie tu dakika moja. You know, are there kinds of food that maybe unaweza ambia our viewers they can be eating to just increase and make sure their fertility iko sawa?
All right, yeah. So, for fertility and diet, the main thing here is just good diet, the right kind of diet. And the right kind of diet basically means pay more attention to greens, for example. Pay more attention to fruits, fresh fruits, a lot of water, and do little of the fast food, fatty food. Try to avoid that as much as possible. The chips that we like eating and so on, yeah, we go slow on such. Do more of the natural foods as well as the greens and fruits. Yeah, we also advocate or advise patients to do exercise. Yeah, exercise is very important because it makes the flow of blood and hormone levels in the body sort of get balanced, and that will give eggs chance to develop and be of good quality, the sperms to be of good quality as well, and therefore it's very important to do that. Reduce the salt intake, don't do too much salt, and try as much as possible to get a lot of natural light, sunlight.
All right. Yeah, thank you so much, Dr. Nondi, for your time. Najua kwamba tumelearn sana. We've learned something, our viewer. And remember, always, you know, on Mums and Babies show, we celebrate life by walking the motherhood journey together. And I'm sure, ukifuata, ile ambayo daktari ametuelezea, if you have any challenge, I'm sure you're going to have a solution. And I know kwamba we couldn't discuss everything about fertility and infertility. Pale kwenye screen, there is Dr. Nondi's number, contact. You can contact him. And then najua kwamba ukiwa ukimpigia simu, he will give you further advice. Until next time. See you! This is your favorite show, Moms and Babies, where we celebrate life by walking the motherhood journey together.
My blood group ni A.
Yeah.
So I just happened to mention to someone, and then I can say, you are so fat. If you don't take care, you'll give birth every year.
Today we want to focus on fertility and infertility, an issue ambao pia inasumbua watu wengi sana. And sometimes when it comes to that issue, the blame is always thrown back to the women. Lakini as per the expert, najua kwamba atatuelimisha na tujue kwamba this issue, how do you go about it, and at the end of the day, at least upate your information.
Stress is a very big factor for both male and female.
Boys wakiwa hii age, kuwafunga diaper throughout, does it cause infertility later in their lives?
Due to the nature of the conversation we'll be having on the show, it will move to 10 p.m. Do not miss.